Hi, I'm Claire and I'm a pelvic health physiotherapist, and today I'm going to take you through scar massage after abdominal birth. There are many benefits to scar massage. These include helping sensation, any areas of numbness, any areas of tension that you might feel within the scar, which may feel sensation of tugging. They also help you to connect with your body. For some, touching the scar will bring back traumatic memories and be very emotive. And if that's the case, it's absolutely fine not to do it. But I would encourage you to speak to a medical professional if this is the case, as it can be that you need some support to process the traumatic birth. Scar massage can also help tissue remodeling that will be going on for weeks and months after scar is formed. This is why it's important to do scar massage from 6 weeks, but also for the weeks and months following the scar formation. We're now going to show you how to do some scar massage and work on the surrounding tissues. The scar we're going to work on is 3 years old, and it's a great example that scars are never too late to start work. So, for those of you at home, you want to just find a natural oil. So that might be coconut, almond, or anything else like olive oil. You just need something to lubricate the skin. So just a gentle bit, and you just want to find your scar, which for us is just down here, and then you're going to put some oil just on the skin above. And you'll just want to start by just gently circles through the tissues, very lightly to start with. And as you feel a bit more confident, you can start putting a little bit more pressure. So I'm just doing really gentle little circles here, just above the scar. Now I'm going to look at the scar, and I'm going to put my fingers just below and just above and do a very just gentle stretch through the scar. Now listen to your body, work to your comfort. If any of this is extremely painful, please do stop. But this just provides a gentle stretch. And you'll work the whole way along the scar. Now, for those of you who are 6 weeks or so postnatal, everything is healed, there's been no complications, no signs of infection, the scab is completely gone, you can start to gently work onto the scar. But again, if you've got severe pain or discomfort, or you're not comfortable, keep working around the scar until maybe you're 12 weeks or so. So I'm now going to put oil directly onto the scar. And I'm going to work with 2 fingers together. So for you, you'd be doing it from this direction. 2 fingers, and I'm sweeping along the scar. And what you'll notice as you go along the scar is there might be some areas that feel tighter or a bit more raised or a bit more bobbly. And there you might want to spend a little bit of time just gently rubbing side to side. So your first technique is sweeps along the scar. And you're aiming for about 10 of those. Then you're going to work across the scar, so up and down. And again, as you're going along, you might start feeling areas that feel more tight or a little bit more discomfort, and spend just a little bit of time rubbing into that area. And again, you'd repeat this 10 times. So all the way along counts as 1, and then you'd head back for number 2. Your third technique is circular motions. So fingers together, circles, as you're going all the way along the scar. And again, same principle, if there's a tighter area, work into it. But listen to comfort. We're not looking for pain, we're just looking to get it moving and slight discomfort. What I then suggest with a towel is just to take any excess oil off. And for some scars, you might be able to pick the scar up between your finger and roll it. Now for this scar at the minute, it's not ready for that yet. But essentially what you're trying to do is pick up the skin and gently roll it between your fingers. And again, any areas of tension, just slowly work into that. We do advise that if you need specific help with your scar or you're finding any of these techniques particularly uncomfortable, that you do seek advice. Try and see a pelvic health physiotherapist or a recommended scar tissue therapist. But this should give you some things that you can start working on from 6 or so weeks postnatal. Thanks for watching, guys. I've created a series of videos to help you in your postnatal recovery. To find out more, check out Fiit and the postnatal plan.